So, doctor, we got another viewer question where they're asking what treatment looks like for someone who has the measles. So we know several people are hospitalized out in West Texas. What does treatment look like in a hospital setting right now?
Yeah, we do not have any antivirals. It's really supportive care. So, if you have encephalitis, trying to get that brain swelling down, pneumonia, oxygen, that kind of thing, but we do not have specific treatments for measles.
So it's basically just waiting out the measles
Yeah.
once you get it and being cared for, tended to.
hmm
All right. Are hospitals in Texas, are they prepared for a possible increase, dare I say, explosion in measles cases?
Well, as I mentioned earlier, we're having a bad flu season, which means that hospital beds are tend to be filled. It just depends on how bad it gets. And of course, if you have a measles patient, you don't want to put them in just a hospital room. You do not want to infect hospital staff, other patients who may be susceptible. So you need special quarantine facilities. So it's just going to depend how many cases we see and how many need to be hospitalized. As I mentioned, last year it was 4 out of 10 had to be hospitalized. Usually we say 2 out of 10, but last year saw more.
So, doctor, going off that, if someone suspects they do have measles, what do you recommend they do? Should they go to the ER, or is there some specific type of protocol they should follow to prevent the further spread you just talked about?
Yeah, they need to call their health care provider because you don't want to just make an appointment and sit in the waiting room with all these other patients, some of whom may be immunocompromised. So, healthcare providers should have protocols set up for potentially measles infected patients.